Hi everyone, this is Dr. Stefan. Welcome to interstitiallungdisease.info. In this one, in this episode, I'd like to touch upon the subject of socializing when you are struggling with lung disease, when you have an issue maybe related to being afraid of getting infections and things like that. And just to share a couple of thoughts and a comment that I received, which encompasses what's going on what's the story for many of the patients who are suffering with different forms of interstitial lung diseases. And of course, your situation may be different, or someone who you care about who has ILD, interstitial lung disease, or pulmonary fibrosis, may be struggling with similar things. But maybe it's important to know that there are other people out there in the similar situation who are also looking to engage with other people to make sure that their life is still continuing in an interesting way. So let me read you the comment. So it's basically this one. So I suffer with progressive hypersensitivity pneumonitis. Under parentheses, this is a form of interstitial lung disease, and I am on mycophenolate steroids and just started antifibrotics. I very much like to socialize, but I am catching infections. Please give suggestions to socialize as well as reduce my risk of infections. Thank you for your videos. So, very nice comment that I received. I think it's the story for a lot of people who might be having to have treatments with immunosuppressants, suppressant agents. So these are medications that reduce the immune response. Many patients who have inflammatory forms of interstitial lung diseases, which lead to lung scarring, so things like hypersensitivity pneumonitis or conditions associated with connective tissue diseases, so things like rheumatoid arthritis, scleroderma, they may need sometimes to be treated with immunosuppressant medications or medications maybe such as mycophenolate or prednisolone or other steroids to reduce the inflammation in the lungs. But at the same time, while that is beneficial for the interstitial lung disease, it can be tricky because it can lead to a higher risk of getting infections. And of course, if you are socializing, if you're trying to meet other people, especially in large groups, it can be a problem. Now, a couple of suggestions, just common sense ones that you may consider. Of course, your case may be different, so discuss this with your doctor as well. See what is available in your local area. Discuss it with your family members, with your friends, if you can, just to see what would be safe for you. I think that's important to just have an idea. And of course, a lot of people struggle with loneliness and not having the support they need. But in many parts of the world, first of all, there may be actually support groups. So, support groups are there for people who suffer with similar conditions. Many of these groups, after COVID especially, which was this was a beneficial thing maybe that came out of the pandemic, is that many of the support groups that were meeting in person are actually now meeting online. So if you have access to a computer or your mobile phone, you have an internet connection, sometimes you can join some of these support groups, and your doctor may advise what is available in your local area, and you can just join a virtual meeting with other people and just discuss things related to your condition, or maybe just play a game online. There's lots of things that can be done. I mean, these may sound silly, but I think support groups are probably the first thing you can consider, especially the ones that have virtual meetings. And you can start with that just to have that feedback, the direct feedback from another person. Now, obviously, the other thing that you can do is maybe if these groups are meeting potentially outside. So if you are outside in a park, somewhere on a terrace where there's open air, generally the risk of getting a respiratory infection is a lot less than when you are in an enclosed space. So if you're in a small room with a lot of people, of course, there's a higher chance of catching infections. If you do have to meet inside in a conference room, in a restaurant, somewhere, I don't know, wherever the group meets, wherever your friends meet, maybe it's important to just let them know that, look, I'm really happy to be here. I want to engage with you, but can we please just open the windows a bit more often? Can we ventilate the air? Can you just please be mindful if you have an infection to not show up to this event because you might give me the infection and I'm vulnerable to catching this infection. Of course, many of you may not want to share the fact that you are on medication, that you have an illness, especially with people you may not know. If you're trying to socialize with strangers sometimes, or people you just met, you may not want to share your medical history. But just maybe mentioning that, look, I'm really happy to meet you. I would like to get to know you better, but I have this risk of infection that's a little bit higher. I'm not a danger to you, but you may not be aware that you could pass me a virus that could be dangerous for me. So I think if you frame it that way with confidence, if you mention this to people, I think most people would go for that, and they would appreciate your honesty, your transparency, and your strength to actually turn up and do things that are more difficult for you. So I think that's one thing to mention. In terms of other suggestions for socializing, to be honest, it depends on your own setting. I would say with friends and family, just try to meet as often as you can. It can be a good support network, and just try not to worry too much. I would say as well, of course, you may be on a medication that can increase your risk of infection, but at the same time, you're not completely vulnerable. Your immune system is not completely gone. You will still be able to fight off most things. It's just that, yes, if someone is coughing, is ill, obviously visibly ill, probably you need to stay away from them for that amount of time while they are recovering. The other thing that you can do sometimes, especially if you're on immunosuppressant medications such as mycophenolate or azathioprine or other things like that, so it may be worth talking to your doctor depending on what type of infections you are getting. If you are getting a lot of bacterial infections, for example, if you're getting a lot of pneumonias, chest infections, things like that, especially if you're getting more than 3, 4, 5 in a year, and you need to take antibiotics every time, is to consider going on a prophylactic antibiotic or a preventative antibiotic. So this can be something like azithromycin, which is an antibiotic that's not taken daily, but maybe 3 days each week. So Monday, Wednesday, Friday, for example. And that can sometimes modulate the immune response and reduce the number of infections that you are getting. Of course, this treatment is not for everyone. I don't recommend it for everyone. But if you are getting a lot of chest infections, a lot of you have a lot of difficulties with infections, this may be considered by your doctor, especially in the colder months if you're living in a colder climate. During winter, it may be worth to go on something like this. Of course, with these treatments, sometimes you need to check whether your body will tolerate going on this medication long term. Generally, antibiotics are designed for shorter term use. So if you're, for example, going on azithromycin long term, it's probably a good idea to have an ECG done before, because sometimes it can influence some of the way the electrical workings of the heart work. Let's just simplify it that way. There's something called QT, which is basically something measured, an interval measured on the ECG, on the heart trace. And if that increases beyond a certain threshold, potentially while you're going on a treatment, that can pose a risk for heart rhythm disturbances. So that's something you may want to check with your doctor first. But it's not necessarily a rule on how to institute azithromycin treatment. Talk to your doctor, see what's relevant in your case, of course. But that can be a good option if you are struggling with chest infections while on an immunosuppressant medication, especially during the winter times. That being said, of course, we are talking about loads of medications. So always talk to your doctor if there's any other option for you, if you need to be on maximal doses of immunosuppression. If your condition has been stable for a while, maybe trying to reduce the immunosuppression a little bit while monitoring the lung function may be beneficial, because if your lung function values are the same while you're reducing the immunosuppression, it may sound like it may indicate the fact that the condition is actually stable. So you may get away with lower doses while controlling the condition. And in this comment, it was mentioned about a condition called hypersensitivity pneumonitis. Now, this is an interesting condition to mention because it is triggered by exposures to things in the environment. So things that we inhale trigger this condition, this inflammation in the lungs. So obviously, the best treatment for that is to remove these exposures. So, for example, one common one is when people are sensitized to birds, to proteins released by bird feathers and things like that. So, in those scenarios, actually avoiding any exposures to dust generated by birds. So, birds flapping their wings next to you, going, in a park and being surrounded by pigeons, feeding birds, keeping feathered pillows, feathered duvets. All these things can actually trigger your condition. So getting rid of these exposures may actually mean that you can reduce your medication while maintaining stability of the condition. So that will reduce the risk of infections. So there's lots of things you can consider sometimes by having a careful discussion with your doctor, by looking at things around your environment that may be triggering your condition, and just being careful with infections. Finally, I would say that if you are getting a lot of chest infections, also you may want to consider getting vaccinated regularly. So, for example, having the flu vaccine every year, having an anti-pneumococcal vaccination every 5 years, or sometimes you only need a one-off shot. Some things like this can be considered. So, of course, these are important things to consider. Hopefully this was helpful, and if you have further questions, do leave them in the comment section below, and I'll try to answer in future videos. All the best to you and good health.